Hey everybody, welcome. This is Dr. Perry Nicholson from Stop Chasing Pain and the Pain Laser Center. Going to do a really brief presentation on treating the thoracolumbar fascia with deep tissue laser therapy, but also treating that fascia in general for a lot of conditions that people have pretty much over their entire body. So you can look at this brief picture here and see, that white stuff right there in the middle. That's the thoracolumbar fascia, and you can tell that it's a bridge from across the body. So you can have an issue in shoulder, hip, ankle, but you got a knee, you have thoracic spine, up and neck, and everything like that. And I'm going to show you a video at the end of one that I've done with Litecure lasers on treating the CrossFit athlete with deep tissue laser and locking that in with some kinesio tape on Rocktape. It is an absolutely fantastic combination to help a lot of pain conditions. So if you look at the next one here, the thoracolumbar fascia is pretty much a linchpin on movement. And I love this graphic picture here on the right because you can see that's basically human gait pattern. I mean, running is accelerated walking pattern, and every human being has to move, and pretty much everyone has to walk. And so you can see how if that thoracolumbar fascia is over tight, it's going to affect this posterior oblique sling here, which means you're going to swing your arm a little bit more. You're going to also alter the function of your opposite side hip. So this is where the your opposite shoulder, check your opposite hip comes from. So shoulder and hip dysfunctions I always find related to the thoracolumbar fascia, but because the thoracolumbar fascia is fascially connected to a lot of other different things internally in your body, but it particularly connects to your diaphragm, which is part of your inner unit and your inner core, as well as your transverse abdominis, which wraps around you like a corset, and the internal oblique, the posterior fibers of your internal oblique, which I do consider part of the inner core as well. And you're going to need your obliques if you want to twist, turn, and rotate in any way, shape, or form, which is what gait is. So when you release the thoracolumbar fascia, you're going to have a huge impact on the relaxing the diaphragm, the transverse abdominis, and the internal oblique. So it's a great way to lock in those three areas in regards to dysfunction. So if I'm going to be doing some laser application, I use the Light Force laser, the 15-watt laser. So I go and deliver it, which you'll see on the video, right over the thoracolumbar fascia. I typically do about 3,000 joules dosage of energy, sometimes as high as 6, depending on the individual that I'm treating. So if you're the size of a house, I'm going to make it a little bit bigger. And I'll use the open cone or the massage ball application. If you look at the picture on the right here, that massage ball is the application. So the laser comes directly out of a special optical ball that you can deliver myofascial soft tissue release at the same time, or trigger point release, that you're doing the laser application. And if you don't have that, you can do open cone, and then you go in later and you follow that up with some soft tissue therapy right after laser. Maybe you want to do some instrument assisted adjusting, stuff like that. So Grasson tools, ART, whatever you think is applicable to your paradigm, it works great. And then you're going to lock that in with some Rocktape, which I'll show you just one application of many on the video. And then you should get into some therapeutic reset exercises, helping them engage and learn to use the posterior oblique sling from the opposite side hip to the opposite side shoulder. So I'm going to exit out of here and bring up the video and just let the video play now, so you can see how I've done that with the CrossFit. Well, with the CrossFit type of workout, obviously, because of the amount of squats and deadlifting that you're going to be doing and overhead pressing, the lower back can take a lot of abuse, even when you do everything with great form. It's just high volume. So if you can laser the low back from the lumbar spine out, so you get the erectors and the deep muscles, which can fatigue very quickly, I'll laser that all through the lumbar spine. And I will do a very high dose down in this region, relax the deep muscles that are typically very, very tight, come out into the side and get some of the quadratus lumborum as well. which can become an issue because they are also extenders of your back. So this can be done prior to an event, a single event or a competition, and it's great to do it post as well, to do a pre and post laser treatment. Can make a big difference on post-workout delayed onset muscle soreness. Then once we relax this with the laser, we're going to go in and we're going to put a strip of tape up each side and then a support strip across the bottom. So when we do taping in the lower back, we're going to put one strip up paraspinals here and one up the other side, and then a support structure right around where most people feel the biggest amount of stress, which is typically L5, S1, but you can do one here and one there if you like. This one we're going to go up and over a piece of tape that was already there, and that's okay. So you're going to actually have to round and stretch the tissue a little bit, so if you have the client standing up or seated so the tissue is stretched, we're going to come down so we go right below the PSIS, or down here on the sacrum a little bit. Going to put the anchor point. Lay the anchor point. Then the tape goes right up the back. Just like that. Rub the tape to activate the glue. Then we're going to do the other side. So you got your two stabilization strips, and now we're going to do decompression right around here. This one you always tear in the center. We're going to put a little bit more in this one. I'm going to do 100%, back off 25%. Lay down the middle. So now that's going to really lift right there. Don't stretch the ends, just lay them down. And now when they stand up straight, you're going to see how the tape has a little bit of a wrinkling in there, and it's going to give you a lot of stabilization into the back, so they feel more stable when they do. They're bending over.